The Mesa Chamber of Commerce Inside Business Podcast brings you a unique view of Mesa through its vibrant business community and the subjects that are important. The podcast is produced in the Mesa Chamber of Commerce Media Studio. Our podcast is hosted by Mesa Chamber of Commerce CEO Sally Harrison. Please enjoy this episode of the Mesa Chamber Inside Business Podcast.
Hello, everybody. This is Jeff Baer from Baer Media Group, and I'm here at the Mesa Chamber of Commerce with the incredible duo of, first of all, I should say that we're here on behalf of the Mesa Chamber Mental Health Subcommittee, and we're promoting and advocating for Mental Health Awareness Month. And this morning we have Kerri Ronquist and Sandy Dyk from All About You Placement and Senior Resources and Seniors Helping Seniors of the East Valley.
There you go.
So these two ladies have tons of energy, and they think we're going to go with some questions that we've already talked about, but I'm going to start with something else.
Oh, of course you are.
Of course.
Okay.
I understand you had a bus trip recently.
Yes, we did.
Tell us about the bus trip and, why it's meaningful for folks that you work with and why you do it every year.
Our bus trip is becoming more and more of a party bus almost. It is a cruise ship on wheels is what we call it. So basically,
it was
touring the valley.
Yeah, when Sandy, we were in the mix of it. We had a moment, we pulled off to the side while everybody was, at one point we lost our group. Because we had about 40 people, we broke up, and Sandy and I lost our group. That probably doesn't surprise you.
We did it.
We didn't lose
in good faith because we offered the elevator to everyone, and we took the stairs,
and then we got lost.
Anyway,
we did look at each other, and she said, remember when we just thought this would be a good idea, and now we're on our third one. Mm-hmm. So really, truly, it boils down to the fact is that when we were out in the field prior, and all the things we were doing, we just saw a lack of fear and a lack of education about what's out there. And usually people call us when a pain point or an emergency happens, and then their tolerance level is different. They're making decisions under really stressed situations. And so we want people to be empowered. So the bus tour really came about because, number one, we always want to have fun, and we want the people that are on with us having a good time, because that is a good thing for mental health, laughing and joy. And we wanted it to be a non-threatening way where people of all ages can get on the bus with us and go see different senior living communities, experience them, allow the senior living communities to love on the people and, put their best foot forward and feed them and have fun with them.
And a big thing too, we're all about education.
Yes.
And it's the folks we come in contact with on a daily basis. It's still very surprising to me how much education still needs to be done, and how many people still see senior living as the old nursing home environment and wheelchairs lined up. And it's just, it presents, this bus tour presents these options to people and the education to people in a way where it's very non-threatening. It's there's no high pressure to do anything. Yep. It's just getting out, like Kerri Ann said, laughing, having fun, and being prepared.
So who goes on this bus tour? And I'm sure all of our listeners are going to want to sign up for that 2027
version. It does last. Yes, it does.
So who goes on the tour?
Yeah, so we've had people of all ages. We've had people in their 20s, grandkids that heard about it and heard it was fun and say, you know what, I hear my mom being stressed about my grandma or grandpa, and I want to know what this is because my grandparents listen to me more. We've had people all the way up into their 90s that are still really rocking and rolling, but they know that it may not be that they have to move to assisted living, but maybe, and we'll talk a little bit about this, maybe their spouse passed, or they're lonely because they live in a house that is, a house where they walk out the door and they see a neighborhood, but there's nobody around. And so they know the meaningful value. So it's people of all ages that come on this, and they just want to gather information, and they just want to see what it is. We have a lot of people that are nosy. I'm a nosy Rosie. So they just want to get in and see what's going on.
I mean, even caregivers, members of our Seniors Helping Seniors team were on the tour, and because they care for aging individuals, and they want to be educated so they can talk, smartly, whatever, to the clients that they're helping.
And our whole team goes. My
dress up
mom
like
went on
Julie
the last
McCoy.
one. Yeah.
We're all little Julie McCoys for the
We
day.
are. And it's fun and it's free. That's another thing, is that our call to action, and something that's been really important to Sandy and I, is that we really dig in and bring value to the communities that support us. And it isn't just, hey, come listen to us talk about diabetes or what we do. The same things that they hear about. This is really digging in and finding some unique spins on it to allow people to just gain power.
Okay, I love what you're saying, but now we got to go back.
Go
We gotta
backwards.
go back a little bit.
Otherwise, we're going to keep going.
No, it's okay to keep going, but
There
we
we
need
go.
to
Yeah.
go back and give this all a little bit more context
Yes.
on who you are and how you got here. So why don't you start with a little bit about you and how you formed this company, and then Sandy, you get into your
Then a little
role,
bit, yeah.
and then we'll go to some questions. How's that?
Yeah. Well, All About You started, it'll be 9 years this August. And it started, I was not in the senior industry of anything. And unfortunately, many, many years prior, my dad went in for a back surgery. We didn't know what we didn't know. And he went into rehab and didn't make it out. And it was devastating to our family. It was when someone leaves you, especially unexpected like that, it is challenging, and we learned a lot. The biggest thing was that you don't know what you don't know. There's a lot of decisions that we made that we probably would have made differently if we would have been properly educated. And so All About You just kind of came about in spite of me, really. I tell everybody that I've got one of the greatest HR directors in the world, and his name's Paul Carmody, and he's in heaven and telling me to hang on. And Sandy joined that whole thing. But really it was, yes. And you would, before All About You, really, Sandy and I were in hospice together. Then All About You came about just because I saw that being involved in a company where I wasn't in control of what I could say or couldn't say was challenging, because that's really what I wanted to do, was dig in and help people, advocate for people, help people find proper placements, really dig in and be face-to-face, boots on the ground with them, and give back to the community. And I was really lucky to meet Sandy, who is one of my very best friends. And she came on board in hospice, and then she saw me struggling with All About You because I hate spreadsheets. She loves them. And she came on board, and then the growth just exploded from there, and our visions have just always aligned, and I couldn't do this without her. And then Seniors Helping Seniors was a gift that we were given because of all the work that All About You has done. And so we decided to take that challenge on and buy the company, and we want to meet seniors wherever they are, whether that's in their home, outside of their home, if they need help in a hospital, whatever that may be. So that's really how this whole thing started, and here we are now. Here we are.
Sandy, you have anything you want to add to that?
Well, she pretty much said it all.
So I have a question for either or both of you. You met together when you were working in a hospice place. So what did you really take out of there? What do you learn when you're working at a hospice? Do you call it a hospice center? What's right?
Well, hospice isn't a place.
Okay.
It's a service, more or less. I mean, there is a place short term that you can go for hospice for intense care needs, but typically it's in your home environment. But through hospice and just through my past in my career, you come to find out that there's so much more than just the immediate care that you're providing. Whether it be hospice, whether it be home care, whether it be helping people find senior living options, you're not just dealing with one thing. You are basically opening a box. You are, I know the old cliche saying, peeling back the layers of the onion, but you really are. And you're dealing with different things going on in the family. You're dealing with different things going on with the individual, kids, everything. And so it's not just a care thing, one easy thing of, okay, you need to move, let's pick a place. Not that at all. Or, you need care coming in the home. Well, now you're dealing with a lot of things with acceptance and independence and all that sort of thing. So there's just with hospice, that just kind of was the beginning for us to see how much need is out there from the full spectrum.
Yeah, and we saw how truly, unfortunately, uneducated a lot of people are, and a lot of medical providers. And the education does not get translated to the families properly in the way that it should. And we saw a lot of times, which we really feel like with both companies we strive for every day, is to be that bridge between the need and the resources, because we see that the bridge is broken many times and people come very frustrated because they know what they need and they know there's resources out there, but they are not educated about how to go through that process, how to go over that bridge, how to truly come out with good outcomes, whatever that may be. And so that's really where we step in, and I feel like we do a really good job of that because of our background and because of what we've seen through the years.
So let's jump into living situations and mental health, home versus assisted living. Talk a little bit about that.
Well,
Yeah.
I mean, it's not necessarily for everyone, but depending upon somebody's situation that they're dealing with in the home, whether that be social isolation, care needs, that sort of thing, that's really the starting point for where our team looks at, okay, what route are we going to first look at and consider? Kerri, and you can talk to me.
Yeah, and to harken back to hospice, we actually would be able to properly put someone on hospice care that we knew was environmentally hospice appropriate. And what I mean by that is that people were in their home, they were isolated, or maybe they were choosing that because they didn't want people to see how bad maybe things have become. They weren't eating properly, they weren't hydrating properly. We saw through COVID that we are humans that need other humans. And so when we put all of that together, we would see people that were really physically, mentally, and emotionally dying in their home, to the point where we could make a case to Medicare that they needed to be on hospice. And then when we would get them into a senior living environment and really get all hands on deck and see them change, we would have to take them off of hospice because they were no longer appropriate.
Which is something I think a lot of people don't realize. When they hear the word hospice, they think death. You're wrong.
Yeah.
But what you're talking about here is a method in some cases to keep them alive.
Absolutely.
Well, and there's been studies done in the past, and you actually extend somebody's lifespan when they're on hospice, because with those additional support systems coming into the home, they're able to do much more for longer.
And it's kind of funny because we saw this. Now, I love doctors. I don't want any doctors to be mad at me for saying this right now. But historically, all the regular general practitioners out there, and even some of the specialists, they only take a very small class on what hospice is. And so they even will have people with them to the point where really, truly, somebody will get put on hospice days before they're going to die, when they could have been on a hospice care so much sooner and gotten all that support. And also too, I'll tell you, I've had cases where I've walked in and there's a little 90-pound lady that shows me all of her medications, and everybody's upset because she's not eating. And I'm like, she's choking down a table full of pills. She doesn't feel like eating. And then as soon as in hospice, we look at the medications that are necessary and try to lessen that, and you will see people get better. So there's a whole bunch of different things that go along with hospice care, but people are not educated. They're fearful, just like what we were talking about with the bus tour.
It's taboo.
That is a thing we
Nobody wants to
want
talk
people
about it.
to understand all the options that are available. I've even had to go in with families and really sit with loved ones where I've had clients of mine beg me to tell the family to stop, because they are tired of getting poked and prodded and being in and out of the hospital. It doesn't mean they're giving up. It doesn't mean they want to die. It just means they're done with all of this aggressive stuff. They just want to be.
Can you talk a little bit how all this has an effect, either positive or negative, on the mental health of the family members?
Well, family members, guilt is a huge thing, and guilt can show in many forms. But when it comes to caring for a loved one, I mean, many members of our team, including my own family, Kerri, and everybody, we've been through this where, just because you are a loved one, a family member, doesn't mean you're the best person to be providing that care for that individual. Everybody feels they need to do it, or society feels they should be doing it. But sometimes the best thing somebody can do is get somebody else that's trained in that area to provide that support. But when it comes to helping folks just mentally deal with the loss of different things as we age, independence, driving, doing things on their own, that impacts the psyche directly.
Well, a lot of it is guilt, a huge guilt, and expectations. And that's the whole part, is that, family members don't know how. There's never a class in high school that says one day you're going to take your dad's car keys away.
Yeah.
There's none of that. And so a lot of times they'll avoid it, or different things happen. And so caregiver breakdown is real. And also, too, it's the way that you approach it. And many times people just don't know how to approach those subjects because they're afraid of taking things away from their loved ones, and the loved ones are afraid they're going to take it away. So you create this system where everybody is not having real conversations. They are not attending to their own needs, and everybody's feeling guilty that they're not doing enough, or then they get into a very unhealthy relationship of caregiver and care person, and then the dynamic changes. And this is where we talk about, like, the sandwich generation isn't one normal sandwich. It's one of those big, huge layered sandwiches where they don't realize that this impacts every level of their family, their business, their relationships, their grandkids, like all of it.
Well, and when it's not talked about within the family, much like mental health, it snowballs. And then it's building and building, and then there comes a breaking point where it's like, okay, we should have been talking and having these conversations much
And a lot
earlier.
of it is perspective too. We try with everyone, and I've tried to gift families this verbiage. It's not about taking things away, or the next, they're getting closer to death, or what, they're getting older. It really is about the next new chapter of life. It is whatever is happening to you, how do we empower people, and how do we allow them to see that with the things they are losing, we need to give them things in return, and then look at this as the next chapter.
So with that said, let's talk a little bit about the role of loneliness and isolation.
Mm-hmm. So I think for many years, we're still going to be referencing COVID, but COVID definitely was a wake-up call to the communities. And we're as human beings, we're social beings. And not to say that we all need to go out and engage in conversation and activities and go, have happy hours and all this. But the thing is that when we are by ourselves, we don't have that people stimulation around us. And oftentimes when we're helping folks, say, consider placement in senior living communities, it's not for everybody, but for those people that tend to be social beings and they're used to interacting with people, they need to be in that environment. Even those that haven't been, you can have somebody who's a pretty social person, but they're happy just kind of sitting back and watching people. They don't have to be actively engaged. But when you're alone in your house, you don't have people coming in, or maybe you do have one person coming in to check on you, things like that, but you need that people contact. It creates purpose for people. And, when you don't have people coming to visit you or see you or interact, it does impact the psyche.
Yeah, we tell people that the big thing, we've had clients where they move into assisted living. If all they do for the first month or so is just go to each meal and come back, it is more exercise than they've done and more social interaction. They don't have to do anything else. And we've seen huge improvements in just that.
Well, and even on our home care side, we have people living alone and the family's concerned. So we have one of our caregivers come in. Well, the caregiver could just sit there, but how is that helping the person? So our caregivers are going in and they're engaging with the clients. They're making sure that there's purpose to the days for those individuals. So, you can sit side by side and do parallel play as we're taught in psychology courses, but really engaging and interacting is so very important, even for the most isolative type people.
So what can families do immediately if they notice some kind of a decline with a family member?
You know what I say, treat people how you want to be treated. I really don't. If somebody sees that I'm having some struggles, I would be really upset if in my right brain that nobody reached out. And sometimes we have to have uncomfortable conversations with the people that we love. But we will tell you that those uncomfortable conversations presented in the right way, being a partner instead of trying to tell somebody what to do, really sitting and saying, this is how it's impacting me. Now, obviously, if cognitive impairment is involved, then it's a whole different trajectory from there. But just really making sure that you don't allow your loved one to just disappear. Have conversations with, remember who they were and what they did. Allow them to reminisce and make them feel relevant, because we all sitting at this table, we're living some big lives. And then all of a sudden, when all these things that we live go away, we're still the same humans. And so just really treat people how you want to be treated. Don't let them just disappear.
On the other side, too, is some people just don't feel comfortable having those conversations. And if the listeners are some of those people, they know something needs to be addressed with a loved one, but they're not comfortable having those talks. That's where Kerri Ann and I and our teams can help out.
With that, let's give the folks some information. How do they get a hold of you? What's your website?
Well,
contact numbers?
So the two totally different companies. So for All About You Placement and Senior Resources, the main number to reach someone is 480-498-2277. If you want to check out the website, it's www.ayYSS.com. And for Seniors Helping Seniors East Valley and Home Care, that number is 480-534-7413. And that website address is www.shseastvalley.com.
Ladies, it's always a joy to be around you. Just an absolute joy. Thank you so much. And it was a pleasure doing this today.
Awesome. Thank you.
This has been a Mesa Chamber of Commerce Inside Business podcast. You can find all podcast episodes at iTunes, Spotify, or your own favorite podcast website. You can also find them online at mesachamber.org. Content of this podcast is copyright the Mesa Chamber of Commerce, unless otherwise noted.